Okay, let's talk about pertussis or whooping cough. I do have a little video here. We'll see if it can work. This is like maybe one of the saddest diseases because it's little babies have this sad, sad little cough. Oh, I don't want that. That is too much. I guess we'll just have to do it like this. We'll make it bigger right here. Okay, here it is.
Whooping cough is an acute respiratory disease that is caused by the bacterium Bordetella pertussis. Symptoms include severe coughing fits with a characteristic whooping sound followed by vomiting. Whooping cough is highly contagious. It can be spread by airborne droplets containing the bacteria, which are expelled during coughing or sneezing. The bacterial droplets can then be ingested by another person, spreading the infection. The bacteria infect the airways and damage epithelial cells. Some epithelial cells have brush-like cilia that beat in a coordinated fashion. Other epithelial cells, called goblet cells, produce mucus. The mucus forms a blanket over the tips of the cilia. It traps dust, pollen, and microbes. The cilia mechanically remove this debris by brushing it up and out of the airways. The pertussis bacteria infiltrate this barrier and attach to the cilia. The bacteria secrete toxins into the area. The toxins that spread through the airways, causing the goblet cells and ciliated cells to rupture and die.
It's some dramatic rupturing.
The bacterial toxins also stimulate the goblet cells to release nitric oxide. This released nitric oxide also damages the cilia, causing them to break. The nitric oxide also causes extrusion, so some of the ciliated cells are forced out of the epithelium. The combination of these effects leads to significant epithelial damage and cilia with confused motion. This hinders the ability to mechanically remove mucus and debris. Mucus is not removed and builds up in the airways.
It's great. It's visual, isn't it? Sound effects. It is the sound effect.
The body attempts to rid itself of this buildup by causing a violent coughing fit. Bacteria containing droplets are released and may infect a new host, beginning the cycle again.
That's just giving you information on how to get the vaccine and why you should get vaccinated. Okay, so that is pertussis, or whooping cough. Bordetella pertussis is the causative agent, and you saw essentially that was better than I could do. It is highly contagious. It is considered a re-emerging disease because people are not getting vaccinated. And prevention is with the DTaP vaccine, and yeah. That's why you need to get vaccinated, because that's a really sad little baby. Okay, anthrax. I mean, this just keep getting more fun. Anthrax signs and symptoms initially resembles a cold or flu. coughing, lethargy, shock, and ultimately death. Bacillus anthracis, or the anthrax toxin, it is not spread from person to person. It's acquired by contact of the endospores. Remember we talked about endospores, specifically anthrax endospores. It's inhaled. The diagnosis is based on identification of bacteria in the septum. Early and aggressive microbial treatment is necessary, and there is an anthrax vaccine for select individuals that may come in contact with it. Pneumonia. Why is pneumonia resistant to penicillin? Though Mycoplasma does not synthesize an enzyme to break down penicillin. Why is this happening? Because essentially penicillin's mode of action is to block the synthesis of bacterial cell walls. So it prevents the bacteria from forming a cell wall. Mycoplasma pneumonia doesn't have a cell wall, so penicillin is not affected. Okay, viruses, viral diseases of the lower respiratory system. Woohoo! So we've done upper, we've done lower bacteria. Now we're doing upper viral. Okay, everybody with me? Influenza, the flu. You basically just have the flu. I don't know what else to tell you. You feel like crap and you have the flu. That's the signs and symptoms. There's type A and type B. And there are, again, mutations, and we can just never quite stay ahead of it with the flu vaccine because it is viral, so it changes rapidly. It's very pretty. It looks like this. There's some drift in terms of, like, is it A? Is it B? This is essentially, it's evolving faster than we can figure out what the vaccine is. That's why your flu shot doesn't always prevent you from getting flu. The virus causes damage to the lung epithelium, and flu patients are susceptible to secondary bacterial infections. My son had the flu, and then he got pleural-C, which is an infection in the lining of the lung, not the lungs itself, but the lining in between your cavity of your lungs, and it causes you to not be able to breathe as well. So diagnosis and treatment, basically you have the flu. There are some things, Tamiflu and things that you can take to reduce the symptoms, but essentially you just sort of have to push through and maybe get the flu shot. And of course, if you have the flu, I think everyone, please wear a mask when you leave the house. If you have to leave the house and you know you have the flu, we would love it if you could wear a mask and not breathe all over us. That would be amazing. Okay. Coronavirus. Yeah, there's a couple of new strains that we are super familiar with after 2020. Fever, shortness of breath, difficulty breathing. A lot of people develop pneumonia. They can't breathe. This is essentially what caused really the whole outbreak, and people couldn't breathe, and we didn't have enough respirators, and we all had to wear masks, and that was 2020 in a nutshell, right? It is a type of coronavirus. There are many. MERS and SARS were before we had the our latest outbreak, spread from the lungs to the heart and potentially the kidneys, and confirmed by the isolation of viruses and antibodies, and now you can just get an at-home test and see if you're positive or negative before you come around others. Okay, RSV, most common childhood respiratory disease, fever, runny nose, cold-like symptoms. RSV can cause damage to the lungs, so you really need to get treated. Here we have some newly infected diseases of RSV, and it's a respiratory infection. It's viral. It's not great. Transmission via close contact with another infected person, and RSV is pretty prevalent in the United States, and there's an amino acid for it, and it's again, prevention is just healthcare employees need to be very, very careful because it can run rampant in a healthcare situation. Hantavirus, HPS. Hantavirus pulmonary syndrome is what the HPS stands for. I usually call it hantavirus. Again, fever, fatigue, cough, labored breathing, transmitted from mice via inhalation. So people are more susceptible when they live in mice-infested areas. Travels through the body via blood, and infection causes widespread inflammation, often leading to shock. There's what it looks like. Human disease more likely as the mouse population increases. That's what I'm saying. It's mostly people who live in rodent-infested areas. Okay, other viral diseases. These are just parrot influenza, the bird flu. There's just some other things that occur that are also viral diseases. Some of these are more susceptible to people who have been immunocompromised, especially